Okay, so the first thing I really want to say this evening is that migraine is a neurological condition. So by neurological condition, what we mean is that migraine is a disease of the brain. So a couple of years ago, people thought that migraine was a cardiovascular disease, so it was to do with the blood vessels. And in some sense, it actually is, but it's primarily a brain condition. And we know that during a migraine attack, certain things actually happen in the brain that bring on the attack. We know that there are certain chemicals involved in that attack, and we know that it's genetic, so migraine tends to run in families. And that's one of the key questions that doctors will ask you when you go and tell them your migraine history, because it is a genetic illness and it does tend to run in families. Second thing there is that migraine is ranked by the World Health Organization as the 12th leading cause of disability worldwide amongst women and 19th overall. And basically what that shows you is how debilitating migraine can actually be. And it's ahead of conditions like psychosis, like dementia, like quadriplegia. So when you're in the middle of a migraine attack, you're actually more disabled than somebody who's missing a limb. And if that attack continues for up to 3 days, then I think we all know how much of an impact migraine can have. So it's definitely not just a headache. The average attack rate is about 2 per month, but that does vary. There are some people who get 2 migraine attacks a year. 1 in 10 people will have a migraine attack every week, and about 4% of people will have chronic migraine, and that's migraine on 15 days or more in a month. So that's migraine every second day. In terms of prevalence then, you'll see here on this graph, it affects more women than men. 3 times as many women as men will actually have migraine. And that's generally put down to a hormonal link. You'll find that before the age of 12 or 13, girls and boys will actually have equal levels of migraine. About 1 in 10 kids under the age of 12 will have migraine. It might not be diagnosed because migraine in kids is often abdominal, so kids will complain of tummy ache or they'll complain of motion sickness and things like that. And it may be isn't until everything else is ruled out and you know that migraine runs in the family that this is when the migraine diagnosis will actually be made. You can also see that migraine tends to peak between the ages of 30 and 40. And this is really when people are at their most active. So you may have your full-time job, you may have young families. So it is an inconvenient time to have migraine. Just to mention as well, in terms of migraine in women and the hormonal link, when girls pass through the age of puberty, a lot more girls will actually come into the fold. And you'll find that a lot of boys will grow out of it. In pregnancy, women tend to see an improvement in their migraine, although that is the time some women will start to have migraine because of hormonal fluctuations. Some women will also have pure menstrual migraine, which is migraine only at the time of their period. And sometimes it's in treating these hormones that you actually rectify the migraine rather than treating the migraine itself. So what are the symptoms of migraine then? Well, the first one, and it's down at the bottom there, is a severe one-sided throbbing headache. It's generally a kind of a boom, boom, boom type sensation that people will complain of. And if you shake your head from side to side or you run up the stairs, you'll actually find that the pain gets worse. Most people with migraine will also have nausea and vomiting. Nausea in most cases, vomiting in some cases. And a lot of people say that as soon as they actually vomit, they feel better. With this in mind, we generally advise people to take an anti-sickness drug or an antiemetic like Motilium or something like that to settle your stomach, whether you feel sick or not. Because during a migraine attack, the stomach stops working. And if you're taking tablets and your stomach isn't working or you're being sick, then the tablet isn't being absorbed into the system and it doesn't get a chance to work. And by the time it actually is absorbed, the attack is probably too far gone to stop at that stage. So that's just something to remember. The next most common symptom then is sensitivity, especially to lights, but to sound and smells as well. So you'll hear people with migraine who lock themselves away in a dark, quiet room just to be on their own because they can't bear the glare from the light, they can't bear the noise in the kitchen, and people just want to get away from it all. So the headache, the nausea and vomiting and the sensitivities are the 3 symptoms of common migraine, or migraine without aura. The next type of migraine then is called migraine with aura. And what we mean by aura is a whole range of neurological symptoms that actually present before the headache phase of the attack. So in terms of the aura, most people will actually get a visual disturbance. So you might see sort of a C shape to the side of your vision, and it's kind of flashing and scintillating to the side. And sometimes it will come closer and then it will move away. Other people will actually get blurred spots in their vision, or you're looking at your piece of paper and you can only see some of the words on it. People will get pins and needles down one side, or they may get numbness and tingling. Other people will find that their speech is affected. So their words are jumbled or they're slurred, and they can't just quite think straight. In very severe cases, there are two types of migraine. One is basilar migraine, and one is hemiplegic migraine. People can actually get temporary paralysis down one side or loss of consciousness, and that's very serious. If you've ever had an aura, you'll know how frightening it can be. But if it's your first time to have an aura, you really should go and see a health professional about that to get it diagnosed, just in case. And also if the pattern of your migraine changes. So if you've always had typical migraine with a headache and things like that, and now suddenly you're getting aura symptoms as well, that's the time to go to your health professional and get it checked out. So, if you've got these symptoms and you're saying, yeah, I've got migraine, but you've never been diagnosed, the first thing to do is to get yourself a diagnosis. So, what can you do? The first two things you're already doing, be proactive and educate yourself. By being here this evening, by reading information in our leaflets, by looking at our website, you're actually educating yourself about your condition, and that's the first thing we recommend people to do. The next thing in terms of migraine is to discover your triggers and avoid them, and I'll look at that next in the presentation. Lead a routine, healthy and balanced lifestyle. In terms of migraine, the more routine you can be, the better. The migraine brain loves routine. Medication is very important, and we would recommend that you're on the right medication. So you're not just going into your local pharmacy and picking up a packet of painkillers and taking them as and when. That you've got your diagnosis and you're taking the appropriate treatment. Non-pharmacological, what we mean by that is non-medication, so alternative or complementary therapies or self-help techniques. And we'll be hearing from some practitioners later on in the evening. And seek help. So not only from your health professionals, which of course is very important, but also from family and friends, from support organisations, and from the specialist services that we have around the country. And again, I'll go into all these things as we go through the presentation. So, this is a slide which gives the results of a study that was done in 2007 by a guy called Kelman. And it looks at the most common triggers for migraine. And as you can see, number one on the list is stress. And in any survey we ever do, stress is always the most common trigger. And it's good to remember that it's not just negative stress like anxiety, but also positive stress. So that can be excitement or looking forward to something like a wedding or a christening or a family party. That can bring on migraine. The next thing on the list is hormones, and we've spoken about that already. And there's not a lot, I suppose, you can do in terms of hormones, but some women will go on HRT, they may give up the contraceptive pill, they may look at hormone treatment. So that is something to bear in mind. The next one on the list is not eating, and that's important because a lot of people, when they think of migraine, they think of chocolate, cheese and red wine as triggers. And it's not really a myth, but it's not really as important as you might think it is. Food is further down towards the end of the list. And sometimes it's how you eat rather than what you eat. So making sure that you get your 3 meals a day, making sure your blood sugar levels are not dropping, making sure that you're snacking, staying hydrated, eating a healthy, balanced diet. And Jess will talk about that later on as well. Now, it could be that you have a food allergy. It could be that chocolate triggers your migraine. But unless you know for definite, then don't go eliminating whole food groups from your diet. Next on the list is weather. Weather is a very common one. There are studies done over the years on the particular weather triggers, and it can vary from person to person. Some people will get migraine as the seasons change. Some people will get it when it's very warm. Other people will get it when it's snowing. So again, it's about finding out what the trigger is for you. You've got sleep disturbances, and further down you've got lack of sleep, and that's a big one. So we would always recommend to people that you keep an eye on your sleeping patterns, making sure, if you can, that you're going to bed at the same time every night, getting up at the same time in the morning. Saturday is actually the most common day for migraine, and that's because people may get up 2 hours later than usual, and they find they wake up with a headache. So getting up at the same time and going back for a nap later in the day is sometimes useful if you have migraine. And the more routine you can be, the better. We often see people who work shift work find that they get a lot more migraine because their routine is all out of sync. Next on the list then, we've got things like perfume and odour. We've got neck pain or posture, which can be a big trigger, and David will look at physical therapy later on in the evening. Lights, it can be the glare from lights. It can be flicker from your computer screen or your television. And again, you'll know that yourself. If you're spending long times at your computer and you're finding you're starting to get headachy, that could be your trigger. Smoke, sleeping late, as we said, heat, and down towards the end, exercise and sexual activity. And in terms of exercise, that can be too much exercise or too little exercise. And we would usually say to people, find a balance. And also do exercise that isn't too high in intensity. So maybe go swimming or cycling instead of running. So how do you work out what your triggers are? Well, we recommend that you keep a migraine diary. And here's an example. And there's a migraine diary in all the packs that you've been given as you came in this evening. Now, this is a sheet from our older diary. We have slightly updated it since. And what the diary is useful for is three things. Number one, working out, is it migraine or is it a different type of headache? And you do this by writing down the duration of your headache, the symptoms of your headache, and the pain intensity of your headache, 1 being dull, light headache, 10 being hugely severe. So when you bring it to your doctor, and if you've got a headache that's lasting 2 days, it's got nausea, it's got vomiting, it's got visual disturbances, and you're finding that on a scale of 1 to 10 it's about 8 or 9, then more than likely you've got migraine. The next thing that this is useful for is medication. And it's useful in a number of ways for medication. Number one is the medication working. So if your headaches are lasting 4 days and you're taking a box of painkillers every time, then it's not working. Also, it's useful to track side effects. So if you're taking long-term medication, you can keep track of the side effects in the diary. And also, you should keep the diary even when you don't have migraine. And when you're taking medication, always write it in. So you can make sure that you're not overusing medication. And then at the end, you've got the possible triggers. So write in anything you can think of. Don't just concentrate on diet. And make sure that you keep it, even on days when you don't have migraine. Keep it for 4 or 5 attacks, and then look back over it and see if there are any patterns emerging. Because sometimes it's not just one thing, sometimes it's a combination of things. And if you look at it in terms of maybe like a ladder, so if you've got one trigger factor you're here, then another one takes you here, another one takes you up again, and eventually you kind of hit the top and you cross that migraine threshold, and this is when an attack comes on. So the more detailed and the more accurately you keep this, the better chance you've got of actually working out what type of headache you have, what sort of medication you should be taking, and what might be triggering it.